Hi, good afternoon. So welcome to Thursday Reading Live. This is me Vandana PS joining you from Needhu's Academy. So sorry for yesterday, and we had some technical glitches yesterday, so that is the reason. And today we have another new topic. So in this video, we will be dealing with a sample question from part B. I'll give you 2 minutes for the preparation of this particular question. Then we will move on to part A. Okay, so here comes the question. So do it. Alright, so coming back to this particular question from part B. Okay, so the question is like, the extract informs us that the change in prescription is due to. So in this question, as you can see, they have not mentioned in which category the question falls under. So any idea in which category the question falls under? So when you read a question from part B, the first and foremost important thing is read the question. Okay, so second step is underline the keywords from the question. So what are the keywords from the question? So here, the keywords include extract, then change, due to. So these are my keywords from this particular question. Okay, yes, okay, Kartika and Riba, good afternoon guys. Okay, so that is the first step, read the question. Then second step is understand the question. So when I say understand the question, it is like understand which category the question falls under. So any idea in which category the question falls under? Okay, any idea? Kartika, Riba and Vidya. Hi Vidya. Yes, any idea which category of question is this? Let me know. Which category of question is this? Any idea? Okay, so this question comes under the category, the third category, which is a notice. Okay, this can be categorized into a notice. It's not a guideline here. It's not a guideline because we can't say this is a guideline, because guidelines, which I can say a set of rules and regulations that someone has to follow. This is not about a rule or regulations or principles. Okay, it's all about electronic prescribing system. So I'll give you a summary of this particular text, that is, they are changing towards electronic prescribing system. So this is a notice to everyone. Okay, so we can categorize into this last category, which is a notice, and you are reading for the purpose, to understand the purpose of the notice. Okay, why this notice? All right, then. So these are my keywords. So that is the first thing. Then understand the question. Then the third thing is read the options, or you can read the paragraph. So here I'll do one thing. I'll read the paragraph. Okay, usually we will read the options first. So now let's read the paragraph. Then we will move to the options. Okay. Yes. Okay. Okay, Kartika, very good. Yes, this is a notice. Okay. Okay, Reshma, good afternoon. Okay, so I'll read the notice. Electronic prescribing system. A case study led by Christy Banfield, Rotherham NHS Foundation Trust found that the switch to electronic prescribing supported effective service delivery and robust data protection when the team switched to remote working. So they have just switched to electronic prescribing system. Why? Because for the effectiveness of service delivery. Okay, then however, the team expects the rollout to be a catalyst, which means they are expecting this will be a catalyst for further efficiencies and a more cost-effective service where patients, pharmacies and dispensing appliance contractors can avoid delays in receiving the prescription and products. Okay, then having piloted the rollout of electronic prescribing at the start of the pandemic, the functionality and its benefits has already been rolled out to the other community teams across the trust. Then, the team now are also considering how the functionality can be safely and effectively integrated within health apps to further improve the ordering and coordination of repeat prescription ordering and improve patients' care and experience. Okay, so that is all about this extract. So let's read the options. Okay, so what was the question? The question is all about this particular extract informs about change in prescription is due to. So what is the change in prescription? Okay, what is the change? That change is they just shifted to electronic prescribing system. And why? What is the reason? Option A. So when you read a question, always connect with your option. Okay, so the first one, because a new invention of an application that improved patients' care. Where is it mentioned? This is a new invention. Invention, which means a new discovery. Okay, so electronic prescribing system, is that a new discovery? Is it mentioned anywhere in the paragraph? Not mentioned. Okay, so we can eliminate option A. It's not mentioned anywhere in the paragraph. This is a new discovery, new invention. Okay, so I eliminated option A. And what about option B? Change in prescription is due to a new method to show the most cost-effective method for hospitals. So my keywords, new method as well as cost-effective. Okay, so the word cost-effective is mentioned somewhere in the paragraph. I have seen it, right? So here they have mentioned more cost-effective. What about a new method and hospitals? Okay, so this is not a method actually. Oh, even if it is a method, I agree. What about for hospitals? Where is this hospitals mentioned? Okay, this is not a cost-effective methods for hospitals. This is a cost-effective method for patients. Okay, as well as patients, pharmacies, dispensing appliance contractors. So not for hospitals. So we can eliminate option B also. It is contradictory. It's not for hospitals. It's for patients, pharmacies and dispensing appliance contractors. So this is contradictory option, or you can say opposite option. So what is the correct answer here? It is option D, a new horizon. Horizon, which means a perspective. Okay, to heighten which means to increase, improve the efficacy which means the effectiveness in rendering service. Okay, so that is all about this particular notice. So the notice is giving information about a new perspective to improve the efficacy or efficiency in rendering service, and that is the correct answer. Clear? Any doubts in this question? Okay, a lot of correct answers. Okay, and Matthew, Reshma, Sajeev, Vidya, Jayan, Kartika, M, Reba, Rijo, Ammu, Abhi. Okay, dear, it is option C. Excellent, very good. Okay, so we have some probabilities here, whether it will be not mentioned or opposite option or contradictory option. Okay, so here option A was not mentioned and option B, it was contradictory option or opposite option, and we have a correct answer here, which is option C. Okay, so let's discuss something regarding part B. So what is part B? So we don't have any separation in part B. Actually part B and C, we will get that particular material in combination together. Okay, so we have 45 minutes for the completion of B and C. So approximately you can take maximum 12 minutes for the completion of part B. 12 minutes for part B, and we have 6 questions. Okay, 6 questions. So the six questions will be like multiple choice questions with 3 answer options, and we have a respected paragraph. Okay, so either you can read the question, read the options, read the paragraph, and apply which method? Elimination method or elimination strategy, or you can read the question, then the paragraph and the option. So whatever it is, do elimination and find out your answer. So don't waste your time. Okay, so that is all about part B. And one more important thing, so when you find out the correct answer, always keep it in your mind that part B is all about paraphrasing. Okay, B and C, it's paraphrasing. So what is paraphrasing? As you know, it means the exact meaning will be there, but it will be entirely different sentence structure. The sentence structure will be entirely different. Okay, yes. Okay, Riba, it's all about part B, elimination method. Okay, so B, yes. Anasuya, good afternoon. Yes. Okay, clear? Any doubts in part B? So this is the third category question. This is a notice. Okay, so which we are reading for the purpose. Alright, which lines are important in a notice? So can anyone say which lines are important in a notice? Any idea? If it is a third category, if it is an email or a memo or a notice, which lines are important? So we can say always the last lines are important. Okay, I'm not saying, okay, last lines will give you the correct answer, but still you'll get a lot of clue when you read the last lines. Okay, yes. So now we are moving to part A. So we have another new topic. It is pilonidal cysts. Okay, pilonidal cyst or pilonidal cyst. Okay. So how was the material? Was it tough or easy or average? Okay, Raki, good afternoon. Yes. Okay, Reshma, Vidya, yes, and Asuya, last lines are always important in the notice. Okay, yes. So coming back to part A. So what do you know about part A? Okay, so same repeated question. So what do you know about part A? This is an average material. Okay, Reba, yes. Okay, this is not that much tough, not easy, but average, yes. Okay. Yes, so what about part A? What is important in part A? What about the time? How can you manage the time? Any easy methods to manage the time? Okay, so okay, Reshma, let's start with the questions and the time. Fine. Okay, so what about questions? 20 questions, right? Okay, 20 questions. Then what about the timing? 15 minutes. So what type of questions? So I can say 1 to 7 set of questions. We have 20 questions in total, and 1 to 7 set of questions which are match the following questions. Then 8 to 14 that can be called short answer questions, and 15 to 20 which are fill in the blanks. Okay. Okay, Priyadarshini, 12 minutes. Okay, dear, it's not actually 12 minutes. We will get 15 minutes to the completion of this part A, but still, okay, you can do part A within 8 minutes also. If you have a lot of practice and understanding, okay, comprehension is important. So, yeah, if you have this understanding, then definitely you can do part A within 8 minutes. Yes. Okay. Then what about, the method? What method we are using here to manage the time, to read the question, to underline the keywords, to find out the answer? What method? Okay, the method is all about, or the strategy, it is skimming and scanning. Okay, so what is skimming and scanning? So when you read a text, always fast read. Don't waste your time. Okay, so fast read a text. So when you fast read something, underline some important words from each of the text. So that is skimming and scanning. Very simple. Okay, so now, yes. So let me know in the comments, what are your keywords from text A? Okay, Vidya, it is speed reading. Okay, skimming and scanning, so yes. Okay, so what are the keywords? What are your keywords from text A? Okay, so actually Vidya, I'm not asking you regarding what are the keywords, I mean the 13 keyword strategy, it's not 13 keyword strategy. I'm just asking you regarding what are your keywords from text A. Clear? Okay, you guys are typing like, okay, 13, okay, then I'll say that 13 keyword strategy, fine. Okay, so what are the 13 keywords? Heading, subheading, then numbers, signs and symbols, names, abbreviations, brackets, italicized or bold words, time showing words, then words related to experiment. The words can be connected with research, the first line of each and every paragraph, as well as bullet points. Okay, so these are the 13 keywords. Then what about your keywords from text A? Let me know in the comments, what are your keywords from text A? Okay, so what are the keywords from text A? A pilonidal cyst is a round sac of tissue that is filled with air or fluid. This common type of cyst is located in crease of the buttocks and is usually caused by a skin infection. Pilonidal cysts are a common condition with more than 70,000 cases reported in the US every year, but many people feel too embarrassed to mention it even to their healthcare providers. So what are the keywords from the first para? Okay, so from text A, I'm just marking all the names. Okay, because there is no heading, no subheading. So the next task is you can mark all the numbers. So before marking the names, let's go with the numbers. So what are the numbers mentioned here? Okay, if the number is mentioned in a word or in figure, whatever it is, you can mark all the numbers. So 70,000. Then from any other keywords regarding numbers here. Okay, pilonidal cyst can cause pain and need to be treated. Then the cyst can be a one time. So again, one time acute problem, or you may have chronic returning cyst. If they are not treated, this cyst can also lead to abscess, which means swollen pockets of infections and sinus cavities. During World War II, then were often called jeep driver's disease because they are more common in people who sit often. Okay, then anyone can get this disease condition, but certain people are at risk, high risk. Okay, then 40, 20 and 35. Okay, so these are the numbers which I've marked 4 times. Yes. Okay, then what about the next one? After the numbers, you can mark the signs and symbols. Any signs and symbols here? Okay, only the sign is second, this second sign. Okay, already we have marked it. Okay, then what about the next one? After signs and symbols, all the names. So, pilonidal cysts. Okay, then any other words, names mentioned here? Okay, any names? Again, the name of the condition. Okay, so jeep driver's disease, again the name called, something else. Okay, so these are the names usually mentioned. Men, okay, so women, workers, people, yes. Then what about the next one? Any abbreviations? Yes, US. Okay, US is mentioned. Then brackets, what about the brackets? Acute, swollen pockets of infection, empty spaces underneath the skin. Then any other brackets? Yes, men are 3 or 4 times. Then this bracket, average age between this bracket, like truck drivers and office workers, again this bracket. Okay, so what about after the brackets? It's all italicized and bold words, nothing mentioned in bold or italicized words. And what is next? The words indicate time. So what are the words indicate time here? Already one time is, I've marked as time. Then often, okay, always. So from the first para, any words that indicate time? I think no words that indicate time. What about second paragraph? Again, no words indicate time. So what about third one? Already I've marked one time, so that is a word, it is a connected word. Okay, so that's all about that. Then any words indicate research related word? No research related word, right? Okay, and what about next? Okay, the first and as well as research, research related words. Then common is a word we can connect with research. Okay, then located, yes, we can connect with research, yes. That's all about research related words. Then what is next? First and last line of each and every paragraph. You don't have to mark it, but always give a special focus to it. And all the bullet points. We have no bullet points, but still these kind of points we can just mark. Okay, men, people between puberty and age 40, workers, as well as people who have overweight or obesity. So these kind of points, just note it. Okay, so that's all about text day. So I'm marking, just coming to your comments. Okay, pylonadal cyst, 70,000 healthcare brackets numbers. Okay dear, very good Reshma. Okay, and pylonadal cyst, buttocks, skin infection. Okay, then Reba, the same thing. Okay, common type. Very good. 70,000 US acute chronic cyst, abscess, sinus cavity. Okay, Vidya. Air or fluid skin infection, 70,000 every year. Okay, every year. Okay, year. Healthcare, very good. Then 70,000 US. Okay, Vaishnavi, good afternoon dear. Okay, so be round sac, located buttocks, skin infection, 70,000 US, many people, pain, one-time chronic, acute, returning abscess, swollen, pockets, jeep drivers, disease, men, puberty, 40, 20, 30, obesity. Very good, excellent. Okay, with their pain, acute, returning, swollen, pockets of infection. Okay, jeep drivers, disease, high risk, puberty and age 40. All right. Then what about text B? What are the keywords from text B? This is a chart mentioned here. So same like all the numbers and headings we can mark. So enrollment, allocation, follow-up, analysis. Okay, then N is equal to 447, 47, 18 diabetic patients, 15 obese patients. Then greater than or equal to 30 kg per M2. Okay, body mass is mentioned, 7 patients, then 4 lactating women, which means breastfeeding women, then 2 patients, 1 patient with connective tissue. Okay, PNS, abbreviation is mentioned, 200, the bracket mixture injection, then 200 as well as again 200 here, excision and primary repair, again 200 all received, all allocated intervention, then again 200 underwent excision and primary repair, analysis 200. Okay, so these are the keywords from text B. Okay, only this much keywords from text B. Eligibility, enrollment, allocation, follow-up, analysis. Very good Vidya, same thing. Yes. Okay, the whole idea is here. Yes. So now we are moving to text C again. Then come on, what are the keywords from text C? Let me know in the comments what are the keywords from text C. So as you can see here, yes, a subheading is here, management of pilonidal cyst, management. Okay, then we have some points, draining the cyst, injections, antibiotics, laser therapy. Okay, as well as all the brackets I'm just marking. Okay, anything else? Yeah, okay, something has happened in between. Okay, so these are the keywords from text C. Yes. Okay, so that's all about text C. It's all about the treatment. So when you read the question, you will understand, okay, the treatment, about all the treatment or the management which is mentioned in text C. Okay. Then what about text D? Complications. Okay, the risk conditions, risk. Okay, after effects, complications, so pain will be there. Surgical, after the, like all surgical procedures, incision and drainage and pilonidal surgical removal can lead to infection. Signs of infection include redness, oozing pus, fever or chills, heat coming from the wound, tenderness. Okay, other potential complications include seroma, then bruise, hematoma, then poor healing, recurrent pilonidal cyst, and what else? Yeah, so these are all about text D. Yes. Okay, so that's all about text D. So now it's time for the questions. Okay, so what about the first question? Any idea? What is your answer? First one. Proceedings to mitigate the pain associated with pilonidal cyst. So instead of proceedings, yeah, proceedings, which means the measures that you are taking, and mitigate, which means avoid. Okay, so measures that we can take to avoid the pain associated with pilonidal cyst. Okay, Vidya, complications, pain, signs of infection, other potential complications. Okay, very good. And what about the first one? Is it C? Okay, so the keywords proceedings, which means the measures, avoid, as well as associated. So any idea which text? And which is from text C. Okay, very good. And where is it mentioned? Okay, so it's all about, they are talking about the laser therapy here, right? Okay, so laser therapy can remove hair which otherwise might become ingrown and cause more pilonidal cysts to come back. So this is all about this measures that you have to mitigate. Okay, yes, that's all about text C. So answer is C. Okay, so that is all about text C. And what about the second one? Invasive strategies implemented to manage pilonidal cyst. Invasive strategy, which means a surgical procedure they're asking. Okay, same thing. Surgical procedure for to manage the condition. So management, of course, it is mentioned in text C, right? And what is the surgery mentioned here? Okay, what surgery is mentioned? It's all about the last para. They are talking about the surgery. Surgery to excise, remove the cysts entirely. So again, it is from text C. So both the questions from text C. Okay, so first one was C, second one again text C. And what about the third one? Very good, Sobi, it is text C. Okay, what about third one? The prodromes of infection. Prodromes, which means the signs and symptoms. Okay, especially I can say not signs, yeah, symptoms. Okay, so what are the signs of infection or symptoms of infection? So where they've mentioned about the symptoms? Okay, prodromes of infection, yes, symptoms of the infection. So that is in text D. Very good. That is from text D. All the complications as well as the signs mentioned. Okay, so like all surgical procedures, incision and drainage and pilonidal cyst surgical removal can lead to infection. Signs of infection. So those are the signs of infection. Okay, so which is from text D. Okay, so that is from text D. Then fourth one. What about the fourth one? The total number of individuals who acknowledge allocated intervention. Yes. Okay, Riba, it is from text B. Very good, dear. Yes, it is from text B. So what are the keywords? Total number, individuals, people. Okay. Then who acknowledged allocated intervention. So which means people who received. Okay, acknowledged here, which means received. And allocated intervention. So the keywords, total number of people received, acknowledged. So what about that one? It is in text B. So as you can see here, it's all about allocated intervention number is mentioned here. Okay, so that's all about text C. Sorry, text B. Okay. Yeah. Then fifth one. What about the fifth one? Okay, Vidya. Very good. It's from text A. The area that are mostly affected by pilonidal cyst. Okay, area. mostly affected. So which is that area mostly affected? Where is it mentioned? It is mentioned in text A. Okay, see. So this common type of cyst is located in the 𝐲𝐓. So that area is mentioned there. So which is all about text A. Okay. Then sixth one. Why is it necessary to have more than one procedure to treat a pilonidal cyst? Okay. So why is it necessary to have more than one procedure? So what about that? Sixth one. Very good. Yes, Reba, it is from text D. Okay. And which is mentioned in the last line. A pilonidal cyst also have a high risk of recurrence after treatment. More than one procedure. So those are the keywords from the question. So yeah, answer is from D. Seventh one. Who are more easily exposed to pilonidal cyst? More easily exposed. Yes. So what about seventh one? Any idea? Okay. Okay, yes. It is from text A. So where is it mentioned in text A? Any idea? Who are more easily exposed to pilonidal cysts? Okay, very good, Akku. So B. Yes, Libin, it is from text A. So that is mentioned in text A. Yes, people are at high risk. That is from text A. And that's all about 1 to 7 set of questions. Yes. Okay. Then, so now we are moving to eighth one. The approach regulated to. So what is the important instruction here? It is in the word or a short phrase, which means maximum 3. Okay. The approach regulated to detach hair, which otherwise might become ingrown and cause more pilonidal cyst to come back. Okay. So the keywords, approach, then detach, which means remove, as well as ingrown. So these are my keywords from the first question, eighth question. Any idea what is the correct answer there? Very good. Okay. A lot of correct answers. Laser therapy. Okay, so B, Reshma, yes, Reba. Okay, Akku, it is laser therapy. And where is it mentioned? The procedure, approach, which means the procedure, and conducted, yes, regulated to detach, remove this particular thing. Yes, that is laser therapy. So which is mentioned in text C in the management. It's all about laser therapy. So laser therapy can remove hair. So that is the keyword, detach your hair. Okay, which otherwise might become ingrown and cause more pilonidal cyst to come back. So that is laser therapy. Okay. And ninth one. What are the two conditions that will develop in patients whose chronic pilonidal cyst is if left untreated? Two conditions. What are the two conditions? Okay. A lot of correct answers. Okay, Reba. Yes, Akku, it is laser therapy. Okay, Monisha, laser therapy. Okay, Susmin, laser therapy. Very good here. So what about ninth one? Which are the two conditions that will develop in patients whose chronic disease condition or chronic pilonidal cyst if left untreated? Any idea? What are the two conditions? Okay, so which is mentioned in text A regarding the two conditions, and what are they? It can lead to abscess and sinus cavities. So if they are not treated, that is if left untreated, chronic pilonidal cyst can also lead to abscess, which means swollen pockets of infection, and sinus cavity. So you don't have to write that bracket there. So it was a very lengthier answer, okay? So that you can write abscess and sinus cavities. Okay, very good, Shiny. It is abscess and sinus cavities, yes. Okay, and yes, 10th one. Which sort of impediment is more typical post to the surgical intervention of pilonidal cyst? So sort of impediment, more typical, common to post to the surgical intervention. So what is the correct answer here? Which sort of impediment? Which sort of impediment, which I can say, what type of complication, right? Yeah, impediment, which means complication. So definitely complications, yeah. What is the answer? The correct answer? 10th one, any idea? Okay, so be chronic from text C. Is it chronic? That sort of impediment, which means the complication. So chronic is not a complication, right? Severe is not a complication. Severe something is a complication, but severe is not a complication. So chronic, it's not chronic. Any other answers? Okay, Priyadarshini, it is infection. Okay, Aisha, infection. Okay. Any other answers other than infection and chronic? Any other answers? 10th one. Which kind of impediment is more common post to the surgical intervention of pilonidal cyst? Okay, Anasuya? Okay, it is pain. So why it is pain? Where is it mentioned, the pain? Okay, so that is from text D, complication, one of the complication they are asking you. And what about the pain? Where is it this pain mentioned? So pain is the most common complication. Pilonidal cyst surgical removal generally causes scarring of the tissues then. So the complication is pain. Okay. Okay. Okay, Anasuya, yes. Reshma, okay. Shiny, Vidya, yes. Libin, it's not infection, it is actually pain, okay. It's pain from text D. Alright, so the next one, 11th one. How many breastfeeding mothers got excluded from the group? Breastfeeding mothers is not directly mentioned, but still synonym is mentioned there. So what is a synonym? How many? How many, which means they need the number. So how many? Yeah, okay. Okay, Reshma, it is 4, right? Okay, Sobi, yes. Shiny, okay. Akku, it is 4. Very good. And that is mentioned in this particular table. Okay. Yes, 4 lactating women. So lactating women, which means breastfeeding women. Okay. And the answer is 4. Very good, yes. Okay, yes, lactating, yes. Very good, Reshma, yes. Okay, lactating mother is mentioned, yes, yes. Okay, so that is, yes, the correct answer is 4. Then 12th one, the condition defined as the fluid buildup that develops as a side effect of this particular disease surgery. Pilonidal cyst surgery. Side effect and the condition defined buildup. Okay, so what is your answer for this one? 12th one? Any idea? 12th one. The condition defined as a fluid buildup that develops as a side effect to this particular surgery. Very good. So that is from text D, and the answer is, okay, so that is seroma from text D. Fluid buildup is a keyword, so that is seroma. Okay, very good, Sobi. Answer is seroma. Then 13th one, the principal element behind, okay, yes, the principal element behind the progression of pilonidal cyst. Principal, the important main element, factor behind the progression, development of this condition. What is the major factor? Yeah, principal element. So which is the main factor? Any idea? 13th one. Main factor behind progression of pilonidal cyst. Okay, so what is the main factor? Any idea? What is the main factor for this particular disease condition? Type, sort of condition, yeah, type, principal condition, or yeah, type. Any idea? 13th one, no idea? Okay, so principal element, which means the type. Okay, that common type, what I can say, principal element, which means the main factor, main type. Okay, so that is from text A. Answer should be skin infection. Okay, skin infection will be the correct answer. Why? This common type of cyst is located in the crease of the buttocks and is usually caused by, so what is the main factor? It's because of skin infection. So answer is skin infection. Okay, okay. Yes, Reba. Okay, 14th one. Which abnormality associated with pilonidal cyst can be treated with administration of antibiotics? Okay. So what is abnormality? Which abnormality they are talking about? Any idea? Okay. 14th one. Which abnormality associated with this particular disease condition can be treated with administration of antibiotics? Okay, administration or antibiotics is an important keyword, yeah. Okay, Shiny, it's clear. Okay. What about 14th one? No idea? 14th one. Okay. Management, which is mentioned in text C. Antibiotics, which is mentioned in text C. So clearly it is somewhere from text C, right? So what abnormality is mentioned here in text C? Any idea? Okay, Aisha, today's material is little bit difficult than yesterday's material. Okay, I agree. Okay, so answer is, see, antibiotics is mentioned here. Management is mentioned here in text C. So what is administration? What is abnormality mentioned here? So antibiotics can treat skin inflammation. So that is a problem. Okay, so skin inflammation is the problem mentioned there. So abnormality, it is a problem. So that problem is skin inflammation. Okay, so answer should be skin inflammation. Okay, that is all about 14 set of questions. Okay, then 15th one, whether a dash got an exacerbate and comprised a sinus cavity under your skin, it is a consequential occurrence and the patient may need an invasive procedure, which means patient need a surgery. Okay, so whether a dash, so whether, if or whether, yeah, if a dash or whether a dash got an exacerbate, which means worse, comprised, which means what? Included, right? So any idea? 15th one. Any idea? What is the correct answer there? Okay. So here in text C, if you have a chronic pilonidal cyst or, okay, it has gotten worse and formed a sinus cavity under your skin, it is a serious case. Okay, so sorry for what has happened. Okay, coming back to the question. Okay, any idea why that condition is exacerbated? So what is the correct answer there? So if, whether, which means if or whether. And that answer is from text C, yes, chronic pilonidal cyst. That is the correct answer. Okay, so if you have a dash, so that is whether you have a dash. Okay, if or whether, both are same. Okay, so if you have a dash or whether you have a dash, so that is chronic. Okay, so this is the correct answer. And it has got worsened, which means exacerbated and formed a sinus cavity under your skin. Okay, so the answer is chronic pilonidal cyst. Okay, then 16th one. More than one procedure may be needed to remove your cyst, as a pilonidal cyst have a risk of dash after treatment. What after treatment? Any idea? What after treatment? 16th one. Okay, so that should be recurrence. Okay, see, pilonidal cysts also have a high risk of recurrence after treatment. Answer should be recurrence. Okay, then 17th one. Okay, so this disease condition were frequently called dash. What is another name? Okay, yes, very good, Shiny. It is recurrence. Very good here. Okay, so what about 18th one? What is another name? Okay, so that should be jeep drivers. This is why, because they are more common in people who often sit. Okay, so that's called jeep drivers disease from text A. And the 18th one, while waiting for your treatment, you can try to manage any pain you may feel by using a dash on the affected area to soothe your skin. In area, 18th one. Okay, so it's from the last para, first line. See, while waiting for your treatment, warm compress, very good, yes. So while waiting for your treatment, you can try to manage any pain you may feel by using a warm compress on the affected area. So answer is warm compress from text C, the final para, first line, yes. Okay, then 19th one. During the follow-up, dash patients were undergone erosion and primary repair. Okay, so follow-up is mentioned in text B. And what about the number? Okay, so this is follow-up. Okay, so what about the number mentioned here? Excision as well as primary repair or erosion. So that is 200. It's not excision, it is the number they are asking you. Okay, so that is 200. Answer should be 200. 200 patients were undergone this excision and primary repair. So that number is here, it is 200. Then the last one, piloneedle cysts are a common condition with more than dash cases. So how many number of cases? And that should be 7,000 from text A. Okay, more than 7,000 cases. So answer is 7,000. Okay, so let me know about your marks. Okay, how many of you got 20 out of 20? Anyone with 20 out of 20? I know that it was a quite difficult material, but still, I'm very eager to know about your marks. How much marks? Let me know. Out of 20? Yes, Reba, Shiny, Aisha, Ashwati, Akku. Okay, Sobi, you got 19? Okay, very good, excellent. Okay, so what about others? 19, 18, 17? Okay. Okay, so if you have any doubts or concerns regarding this material, you can comment it here. I'll definitely reply. Okay, so that's all about today's session. And I'll meet you tomorrow. So take care. Good day.